Okay, so today we're going to talk about plantar fasciitis. So what is plantar fasciitis? It's a very loose used term. A lot of times, anytime there's a problem with a foot, we kind of slap the term plantar fasciitis on it, even though that's not actually what's going on. And what the plantar fascia is here along the sides of the foot there's a plantar fascia, and here in the middle of the foot here is a plantar aponeurosis. And really what they are is kind of like a sheath or an umbrella or a small covering that kind of holds some of the muscles deep to that point in place. So some of the muscles that are deep to that point, and a lot of times where the problems are the quadratus plantae muscle, the flexor digitorum brevis, the flexor digitorum longus, and the flexor hallucis brevis as well. So, and a lot of times the problems might be right here on the heel bone or on the calcaneus bone. A lot of times we'll have problems in the arch of the foot, even sometimes out towards the lateral side of the foot. So as far as symptoms for plantar fasciitis, a lot of times people females that wear high heels, anyone who has a high arch, a lot of times will have plantar fasciitis problems. A lot of times runners will have problems, sprinters, anyone who is pushing off a lot on the balls of their feet will have plantar fasciitis problems, or may have plantar fasciitis problems. Anyone who stands a lot, a retail worker, someone who works in a warehouse, anybody with poor shoes, worn out shoes, a lot of times we'll get problems in the bottom of the foot. And the reason we have problems in the bottom of the foot is what will happen is when the body's load exceeds the body's capacity to handle that load, we get problems, usually resulting in pain. So, for example, if she were a marathon runner and she were just running away, increasing her mileage on her running, pounding on the bottom of this foot, eventually the body's demand, or the body's loading on the bottom of this foot, is going to overdo the body's capacity to handle that load. And that's why we're going to get problems down there. So, treatment for plantar fasciitis. Traditional treatment, there's ice, heat, sometimes ultrasound will help. Even like a foot roller or a foot log will help. A lot of times these treatments, even though they are effective, will take a long time to have significant effects. And what we like to use in our office, we use active release technique. And what we're able to do with active release technique is we're able to manually break down scar tissue. We're able to palpate where exactly the problem is, whether it's up here in the balls of the foot, down by the heel. We're able to find out where the problem is. We're able to break down the problem, and we're able to find out exactly where the other issues are. Because a lot of times with plantar fasciitis, the problem isn't just in the foot. A lot of times there's problems with the Achilles heel. A lot of times we'll even have problems clear up in the gastrocnemius or the calf muscles, and those will be referring pain to the bottom of the foot. So what we're able to do with active release is find out exactly where the problem is, and we're able to take that muscle that should be like a rubber band. It should be pliable, and muscles should slide over each other in a nice fashion. And anytime that isn't happening, we have a ropey, tight muscle. So we're able to find out where that ropey, tight muscle is, and we're able to break it down, and then we're able to find out where along the chain there are other problems, resulting in the plantar fasciitis.